Welcome to Crohn's Wellness, where wellness meets wisdom and your health takes center stage. If you're on a quest for a healthier, happier you, you're in the right place. But before we dive into the treasure trove of well-being, hit that subscribe button, give us a thumbs up, share the wellness love, and drop a comment below. We thrive on your support. Thanks, loyal viewers, for joining us on this journey. Let's soar to new heights of health together. Today we have a topic that's not only important, but also incredibly relevant to many of us: chronic kidney disease. We're here to empower you with knowledge that can make a real difference in your life. All right, let's jump into today's topic: chronic kidney disease, or CKD for short. It might not be the most glamorous topic, but trust me, by the end of this video, you'll understand why it deserves our attention. First things first, what is CKD? Well, it's a condition where your kidneys gradually lose their ability to function properly over time. Now, I know what you're thinking. Why should I care about my kidneys? Well, the kidney are two bean-shaped organs. They reside against the back muscles in the upper abdominal cavity. They sit opposite side each other on either side of the spine. They extract waste from blood, balance body fluid from urine. Some important functions of the kidney are waste excretion from the blood. The kidneys filter out toxins, excess salts, and urea from urine. Kidneys are also responsible for the water balancing in the body. They react to changes in the body's water level throughout the day. As water intake decreases, the kidneys leave water in the body instead of helping excrete it. Blood pressure regulation are another important functions of the kidneys. Kidneys regulate blood pressure by secreting hormones. And keeping balance of water and salt in the blood. When the kidneys don't get enough oxygen, they produce hormones called erythropoietin. This stimulates bone marrow to produce more oxygen-carrying red blood cells. Foods we eat can either increase the acid in our body or neutralize it. Kidneys keep healthy balance of chemicals in the body. So, you see, these bean-shaped organs are true MVPs in our bodies. Have you ever wondered what causes chronic kidney disease? Worry not, because I'll explain it to you. The most common causes of CKD are high blood pressure and diabetes. Each kidney contains about 1 million tiny filtering units called nephrons. Any health condition that injures or scars your nephrons can cause kidney disease. Diabetes and high blood pressure can both damage your nephrons. High blood pressure can also damage the blood vessels of your kidneys, heart, and brain. Your kidneys are highly vascularized, meaning they contain lots of blood vessels. So, blood vessel diseases are generally dangerous to your kidneys. Autoimmune diseases such as lupus can damage blood vessels and produce antibodies against kidney tissue. There are various other causes of CKD. For example, polycystic kidney disease is a hereditary cause of CKD. Glomerulonephritis can be due to lupus, or it can appear after a streptococcal infection. Chronic kidney disease is a condition characterized by the gradual loss of kidney function over time. Several risk factors contribute to the development and progression of CKD. Understanding these risk factors is crucial for prevention, early detection, and management. Here is a detailed explanation of the key risk factors for CKD. Diabetes is one of the leading causes of CKD. High levels of blood glucose over an extended period can damage the small blood vessels in the kidneys, impairing their ability to filter waste and fluids effectively. High blood pressure can damage the blood vessels in the kidneys, reducing their ability to function properly. It is both a cause and a consequence of CKD, creating a dangerous cycle. Individuals with a family history of kidney disease, especially close relatives like parents or siblings, may have a genetic predisposition to CKD. The risk of CKD increases with age. Aging kidneys may naturally experience a decline in function, making older individuals more susceptible to kidney-related issues. Smoking has been linked to the progression of kidney disease. It can damage blood vessels and decrease blood flow to the kidneys. Obesity is associated with an increased risk of developing diabetes and hypertension, both major contributors to CKD. Conditions like heart disease and atherosclerosis can impact blood flow to the kidneys, contributing to CKD. Certain autoimmune diseases, such as lupus and rheumatoid arthritis, can cause inflammation that affects the kidneys. Prolonged exposure to certain medications, environmental toxins, or illicit substances can be nephrotoxic, causing damage to the kidneys. Some racial and ethnic groups, such as African Americans, Hispanics, and Native Americans, have a higher prevalence of CKD. Understanding these risk factors and taking proactive steps to address them can significantly reduce the likelihood of developing chronic kidney disease. Regular checkups, a healthy lifestyle, and management of underlying health conditions are key components of kidney health and overall well-being. Now, how do you know if your kidneys are sending out distress signals? Chronic kidney disease is often referred to as a silent disease because it may progress without noticeable symptoms in its early stages. However, as the condition advances, signs and symptoms may become more apparent. Here's a detailed explanation of the common signs and symptoms of chronic kidney disease. As kidney function declines, there is a buildup of waste products and toxins in the blood, leading to fatigue and weakness. Anemia, a condition characterized by a decrease in red blood cells, can also contribute to feelings of exhaustion. Changes in urination patterns are common in CKD. This can include increased frequency, especially at night, foamy urine, or difficulty urinating. The kidneys play a crucial role in maintaining fluid balance in the body. As they lose function, excess fluid may accumulate, leading to swelling in the legs, ankles, face, or hands. The accumulation of waste products in the blood, such as urea, can lead to persistent itching, often felt on the skin. Chronic kidney disease can both cause and be exacerbated by high blood pressure. Uncontrolled hypertension can further damage the kidneys, creating a harmful cycle. As waste products build up in the bloodstream, individuals with CKD may experience a loss of appetite and unintentional weight loss. The accumulation of toxins in the blood can lead to nausea and vomiting, especially in more advanced stages of CKD. Impaired kidney function can affect brain function, leading to difficulties concentrating, memory lapses, and cognitive changes. Disruptions in sleep patterns, including difficulty falling asleep or staying asleep, can be associated with chronic kidney disease. Electrolyte imbalances resulting from impaired kidney function can lead to muscle cramps and twitching. Fluid retention and the accumulation of waste products can affect the lungs, leading to shortness of breath, especially during physical activity. CKD can affect the balance of minerals in the body, leading to bone health issues such as bone pain, fractures, or an increased risk of osteoporosis. Impaired kidney function may lead to a buildup of potassium in the blood, which can cause irregular heartbeats and other cardiovascular issues. It's important to note that individuals with CKD may not experience all of these symptoms, and the severity can vary. Additionally, many of these symptoms become more noticeable in the later stages of the disease. Early detection through routine screenings and monitoring of kidney function is critical to managing chronic kidney disease effectively. If you experience any of these symptoms, it's crucial to consult with a healthcare professional for a proper evaluation and diagnosis. Diagnosing chronic kidney disease involves a combination of medical history assessment, physical examination, and various laboratory tests. Early detection and accurate diagnosis are crucial for effective management. Here's a detailed explanation of the diagnostic process for CKD. The healthcare provider will start by taking a detailed medical history, asking about risk factors such as diabetes, hypertension, family history of kidney disease, and exposure to nephrotoxic substances. A physical examination may also be performed to assess signs such as swelling, blood pressure, and overall health. Hypertension is both a cause and a consequence of CKD. Regular monitoring of blood pressure is essential to identify and manage hypertension, which can contribute to the progression of kidney disease. Diagnosing chronic kidney disease through blood tests involves a comprehensive analysis of various markers that reflect the functioning of the kidneys. The primary blood test for CKD diagnosis measures the level of creatinine, a waste product produced by muscle metabolism, in the blood. Creatinine is filtered by the kidneys, and elevated levels suggest decreased kidney function. Additionally, the estimated glomerular filtration rate is calculated based on creatinine levels to provide an estimate of overall kidney function. A low GFR, typically below 60 milliliters min 1.73 square meters, indicates impaired kidney function. The blood urea nitrogen test is another indicator, measuring the amount of urea nitrogen in the blood. Elevated BUN levels may signify reduced kidney function but can be influenced by factors outside the kidneys. A complete blood count is often included to assess for anemia, a common complication of CKD. Together, these blood tests provide a comprehensive overview of kidney health, helping healthcare professionals stage CKD, identify its underlying causes, and formulate an appropriate treatment plan for individuals at various stages of the disease. Regular monitoring through follow-up blood tests is crucial for ongoing assessment and management of CKD. The diagnosis of chronic kidney disease is significantly aided by urinalysis, a diagnostic test that examines a urine sample for various indicators of kidney health. In the context of CKD, urinalysis is crucial in detecting abnormalities such as proteinuria, hematuria, and other urinary constituents. Proteinuria, the presence of excess protein in the urine, is a key marker of kidney damage as the kidneys normally filter out and retain proteins. Hematuria, the presence of blood in the urine, may indicate damage to the kidney's filtration system. Additionally, urinalysis assesses the specific gravity and concentration of the urine, providing insights into the kidney's ability to concentrate and dilute urine appropriately. The presence of abnormal cells or particles can also be indicative of kidney issues. The urine albumin to creatinine ratio is a specific test that measures the ratio of albumin, a protein, to creatinine in the urine, aiding in the identification of early kidney damage. Urinalysis, in conjunction with blood tests and imaging studies, contributes to a comprehensive diagnostic approach, allowing healthcare professionals to stage CKD, understand its underlying causes, and tailor treatment plans accordingly. Regular monitoring through follow-up urinalysis is essential for tracking the progression of CKD and adjusting interventions as needed. The urine albumin to creatinine ratio plays a crucial role in diagnosing chronic kidney disease. This test measures the ratio of albumin, a protein normally retained by the kidneys, to creatinine in the urine. An elevated ACR indicates increased levels of albumin in the urine, signifying potential kidney damage, especially in the early stages when symptoms may not be apparent. This ratio accounts for variations in urine concentration, providing a more accurate assessment. Particularly vital for individuals with diabetes or hypertension, the ACR helps identify microalbuminuria, an early indicator of kidney dysfunction. As part of a comprehensive diagnostic strategy, the ACR aids in staging CKD, understanding its progression, and guiding tailored interventions to manage and preserve kidney function. Regular monitoring through follow-up ACR tests is essential for ongoing management of CKD. Imaging studies, including ultrasound, CT scan, and MRI, are instrumental in diagnosing chronic kidney disease by providing a visual assessment of the kidneys and surrounding structures. Ultrasound offers a non-invasive and cost-effective method to evaluate kidney size, shape, and detect any abnormalities such as cysts or obstructions. CT scan and MRI provide more detailed cross-sectional images, aiding in the identification of structural issues or masses within the kidneys. These imaging techniques help healthcare professionals assess the overall health of the kidneys, identify potential causes of CKD, and determine the severity of the condition. Additionally, they assist in differentiating between acute and chronic kidney issues, guiding appropriate treatment strategies. Integrating imaging studies into the diagnostic process ensures a comprehensive understanding of the kidney's structural integrity and contributes to a more accurate diagnosis and management plan for individuals with CKD. Kidney biopsy is a diagnostic procedure used to diagnose chronic kidney disease by obtaining a small sample of kidney tissue for microscopic examination. While less commonly performed compared to other diagnostic methods, kidney biopsy is often recommended when the cause of CKD is uncertain or when specific kidney diseases need confirmation. During the procedure, a thin needle is inserted through the skin into the kidney to collect a tissue sample, which is then analyzed under a microscope to assess for abnormalities such as inflammation, scarring, or damage to the kidney structures. Kidney biopsy provides valuable insights into the underlying cause and severity of CKD, guiding appropriate treatment decisions and prognosis. Although it carries some risks, including bleeding and infection, kidney biopsy is a vital tool in the diagnostic arsenal for individuals with CKD, particularly those with atypical presentations or complex medical histories. In addition to standard diagnostic measures, chronic kidney disease may be further assessed through additional tests such as monitoring electrolyte levels and conducting a parathyroid hormone test. Electrolyte levels, including potassium, sodium, and calcium, play a crucial role in kidney function and overall health. Abnormalities in electrolyte levels, often observed in individuals with CKD, can indicate imbalances that may affect nerve function, muscle contraction, and heart rhythm. Monitoring these levels helps healthcare professionals assess the progression of CKD and guide interventions to restore balance. The parathyroid hormone test evaluates the balance of minerals in the body, particularly calcium and phosphorus, which are regulated by the kidneys. Elevated PTH levels, commonly seen in advanced CKD stages, may indicate secondary hyperparathyroidism, a condition where the parathyroid glands become overactive in response to imbalances in mineral metabolism. By assessing electrolyte levels and PTH levels, healthcare professionals gain valuable insights into the metabolic consequences of CKD, enabling them to tailor treatment strategies and optimize patient outcomes. These additional tests complement standard diagnostic assessments, providing a comprehensive approach to managing CKD and its associated complications. But hey, it's not all bad news. There are steps you can take to prevent or manage CKD. And guess what? It involves some of our favorite things, a healthy lifestyle. From maintaining a balanced diet to staying physically active and keeping tabs on your blood pressure and blood sugar levels, it's all about making small, positive changes. Speaking of which, let's dive into some quick tips for kidney health. Hydration is key. Make sure you're drinking enough water. Cut back on salt and processed foods, and incorporate more fruits and vegetables into your diet. And don't forget to get moving. Exercise is not only great for your heart, but also for those hard-working kidneys. And there you have it, our crash course on chronic kidney disease. Knowledge is power, my friends, and by understanding and taking care of our kidneys, we're investing in our overall well-being. And of course, drop a comment below if you have any questions or if there's a health topic you'd like us to cover in future videos. If you found these videos helpful, make sure to adopt the healthy habits into your lifestyle. Share this video with friends and family to spread the knowledge, and hit that subscribe button for more health insights. Your support means the world to us. Stay healthy, stay hydrated, and until next time, take care. Thanks for watching. Subscribe, and see you in the next video.